When severe tooth loss occurs, the standard medical response is often a set of removable prosthetics. But relying on plastic and metal to replace a biological structure comes with a steep physical and emotional toll. Consider Sarah, a 58-year-old retired teacher. After 7 years of wearing a loose lower denture, she developed painful sores on her gums from constant friction. Without natural tooth roots to stimulate her jaw, her lower facial profile had started to change, taking on a sunken appearance. Her dietary choices were limited. She hadn't been able to comfortably bite into a crisp apple or chew a piece of steak in nearly a decade. Removable dentures are a surface-level fix. They sit on top of the gums, masking the cosmetic issue entirely, while the jawbone beneath them silently continues to recede from a complete lack of stimulation. To permanently replace missing teeth and stop bone loss, Sarah's dentist recommended a standard full-arch restoration, surgically placing 8 to 10 individual straight titanium implants into her jaw. But as this timeline chart shows, that method introduces a significant biological constraint. Because Sarah's jawbone had already degraded, she would need to endure invasive bone graft surgeries and wait through a 14-month process just to build enough foundation to support those straight implants. Then there is the financial barrier. A multi-surgery procedure of that scale routinely costs £16,000 in the UK and $30,000 in the United States. Seeking an alternative, Sarah found a specialized 4-hour surgical protocol performed in Muscat, Oman, one designed to function without bone grafting. Sarah's experience illustrates the choice many patients face between accepting local price structures or seeking alternative surgical protocols available elsewhere. The process in Muscat begins with precision mapping. Using a 3D scanner, surgeons create a digital model of the patient's skull, mapping jawbone density, sinus cavities, and facial nerves. Standard straight implants require deep vertical bone to anchor securely. If that foundation recedes, they fail. The All-on-4 protocol solves this biomechanically. First, 2 titanium implants are driven vertically into the robust front jawbone. Then 2 posterior implants are inserted at a 45-degree angle. Tilting those back implants increases their surface area contact with the bone. It also allows the surgeon to bypass the sinus cavities in the upper jaw and the nerve canals in the lower jaw. By treating the deteriorating jaw as a structural engineering challenge, surgeons can achieve stability using the patient's existing bone. This initial mechanical stability is the foundation for a technique called immediate loading. Because the angled implants are held so tightly by the bone, the surgeon can attach a functional temporary bridge to the posts on the same day the failing teeth are removed. While the patient leaves with a working smile, this microscopic view shows that the biological process is just beginning. Over the next 3 to 6 months, living bone cells grow around and fuse into the textured titanium, a process called osseointegration. To ensure the implants do not shift during this fusion phase, patients follow a fork-soft diet. If a piece of food cannot be cut with the side of a plastic fork, it is excluded from the diet. Once the jawbone has bonded to the titanium, the patient returns to the clinic. The temporary bridge is replaced with a digitally designed final prosthesis, typically milled from solid zirconia. Permanent success relies on this 2-stage approach: a mechanical fix on day 1, followed by a completed biological fusion. For Sarah, the immediate fix meant that on the evening of her surgery, she was able to eat a solid, pain-free meal for the first time in years. The fixed bridge provided the internal structural support her lower jaw lacked, which addressed the sunken appearance of her lower face. This outcome is the result of Oman's investment in medical infrastructure. Muscat has developed specialized centers focused on these specific, high-complexity surgical procedures. This chart shows the financial data behind this trend. Sarah saw a 30% reduction in total cost compared to her quotes in Europe, despite utilizing the same titanium implant brands. These financial differences were significant enough to cover her travel and a stay in a recovery environment overlooking the Gulf of Oman. The All-on-4 protocol in Muscat demonstrates how specific biomechanical adjustments and globalized healthcare can compress a year-long surgical path into a single day.